My recovery journey started from a very young age. I actually went through my first treatment when I was 18 years old. I started dabbling in marijuana, alcohol, and then it progressed to cocaine, probably around the age of 16, 17. My first treatment at age 18, and then I really enjoyed treatment. I was like, yes, I finally understood that it wasn't a moral issue, that I had an illness that I need to deal with, and there was things I could do to manage that illness. And I decided to go to school to become a drug and alcohol counselor. And I did that for 8 years. I loved it. I started working with youth and then progressed to working with women and in all kinds of different settings, inpatient, outpatient. And then I experienced a relapse myself after I had fallen down some stairs in the middle of winter, and I herniated a disc in my back. And that resulted in me getting on prescription opiate medications. And I was overprescribed opiate medications. And when those medications got removed, I ended up turning to street drugs, specifically heroin, and then also methamphetamine. And it was 4 years of a lot of chaos and destruction, a lot of pain. I was alienated from my family, ultimately ended up homeless. And then I encountered a program called Minnesota Adult and Teen Challenge. And so I went through an entire year of treatment and then another entire year after that of structured sober housing. And that's what ultimately turned it around for me. It was long-term treatment, and that enabled me to get into long-term recovery and got my LADC license back, my counseling license, and ended up starting Rise Up Recovery.
One of the roles that I take with our department is reaching out to any organization that is willing to partner with public safety and our community. We link them up directly to those people so that they can get those services started that day. So Cottage Grove Public Safety is partnering with Rise Up Recovery, and we've offered one free community training where the community can come in, they can learn about overdose awareness, they can learn how to use a Narcan, Naloxone, get a free kit as Rise Up Recovery partners with the Steve Rumler Foundation to offer those kits to anybody who comes to those trainings and or can come down to Rise Up Recovery. They call them an access point for Naloxone, and get a kit if you need it. Anybody in the public can have them. State law provides that anybody can have them so that you can use them for yourself and or for a friend or anybody that would be seen as in need. You won't be in trouble if you help somebody that has an overdose, and even that person who's needing help won't be prosecuted because they maybe have a little drug paraphernalia with them.
Naloxone is a medication that reverses an opiate overdose. So when somebody takes too much opiates or they start going into cardiac arrest or respiratory arrest, because of opiate medication, you can give Naloxone and it will reverse that and revive people. Naloxone is a medication that has saved my life multiple times. I am a recipient of Naloxone 3 separate occasions, of which I was experiencing opiate overdose, and it revived me all those 3 times. One time I needed to be on a Naloxone drip because I took a long-acting opiate medication. So I was on a Narcan drip for 3 entire days. So this medication, I wouldn't be sitting here today. I wouldn't be able to do the work that I'm doing had I not had access to this medication.
After our community training, a few of us got together and said, we think we should expand this to more of our staff. As a whole, Cottage Grove Public Safety is supported by our entire organization. We support our public works staff, we support our parks and recreation staff when they have activities, but we need their help too. And we recognize that these folks are out in the community every day, in our parks, on our streets, and having that opportunity for folks to be more aware and possibly, if they have a kit with them, could help somebody that could be seconds away from dying. Cottage Grove, as far as I know, will be one of the first communities in the state that says we're going to take all of our staff and we're going to provide them access to education around that awareness and around the ability to use Narcan.
This is really incredible initiative on their part to show they're in support of really this public health crisis and being part of the solution to this problem. You know, we are seeing people and our young people overdose and lose their lives at unprecedented levels because of fentanyl. We're seeing this drug being very deceptively in counterfeit pills that is so accessible to our young people today on social media. And so it is so important for our youth to be educated, really that one pill can kill, and even youth who are experimenting. It's no respecter of persons. It can come at any household and any socioeconomic class, in any race. And so it's so important for the Parks and Rec staff and people who have connections with youth and even family members to be aware of this and to be educated and to have access to this medication. It's one of those things where you don't want to have regrets of if only I had known, if only I had had this information, if only I had had, one of these kits accessible, maybe my child would still be here. So we really want to have people armed and prepared just in case.
The signs of an opiate overdose really start with being lethargic. It's not uncommon where you'll see someone all of a sudden, just in a snap of a finger, go from alert to unconscious. And a lot of the illicit drugs that are out right now are laced with fentanyl. And that is one of the scariest things that we deal with in public safety as a whole, is we just don't know for sure what people are ingesting. Those signs could be agonal breathing, where they're just not taking very many breaths. They just cannot be woken, or that they're just not breathing at all. And it is one of the scariest things that you can ever see happen in a short amount of time.
I think it's so helpful to put faces and voices to individuals who are in recovery or who may be struggling with substance use disorder. Historically, there has been a tremendous amount of stigma, a lot of labeling, but the reality is that you have people who are walking around in our town that you would never have a clue are battling this illness. So really personalizing it and humanizing it and recognizing how prevalent it is. And 1 in 10 individuals in their life will struggle with substance use disorder. And so us having an environment that it's safe to talk about and it's safe to reach out for help and to access resources is crucial for people to get wellness. We know that there's disparities amongst people who don't feel safe, amongst people who have been marginalized in accessing resources, and they're dying because of that. So Cottage Grove and Rise Up Recovery, taking a stand and having a voice and offering these resources in a really safe environment, I think is some of the best work that we can be doing. Don't hesitate to reach out for help. That's my biggest encouragement. Reach out, have a voice, don't keep anything in the dark, bring it out to light, and there's so many resources and support services available for you. Recovery is possible. We do recover. I'm living proof.
The number one consideration I would ask people to think about is simply, what if this was your child? And if it was, how much help would you want us to try to give them? If it's mine, I want every opportunity possible.